Hi, we have already created a video about Masters in Hospital Administration after BDS, the link of which would be given in the description below. In today's video, we have with us Dr. Mueez Dalvi, who after completing his BDS from Bharati Vidyapeeth Dental College and Hospital, went on to do his Masters in Hospital Administration. Currently, he's working as the assistant manager for operations for Cloud9 Group of Hospitals, Mumbai. He would be giving us an overview of his journey of doing MHA and working in the field after BDS. Hi, doctor. It's
Yeah.
very lovely to see your journey from BDS because you were in the college where I did my master's and you took the quick decision of jumping out of dentistry, whereas others take a lot of time. After that, you've come here to help and guide others as well. So, first of all, thank you and welcome.
Thank you, sir, Dr. Satish, for giving me this opportunity. It will be my pleasure to, whoever will be the budding dentist, to let them know that, what the other options are available for the dental graduates.
Thanks a lot. So, my first
Yeah.
question for you is you were quick in deciding that dentistry is not for you and MHA
Yes.
you did. You went into a non clinical. What made you
Right.
realize that?
So what made me realize that, when I joined dentistry, the curriculum when I saw, so it was more of, it is not only, when we compare it with MBBS, in MBBS, it's theoretical and practical. There's no, that much art or anything involved where, you need to show your skills, carving or, to replicate something. But here in dentistry, when I joined, it was more of, every definition had an word art attached with it, and that is something which I was not totally, I was not aware about before joining dentistry, that I will have to do all these things, carving and all the stuff which was involved. Basically it is on the art side. So eventually that had an impact on my clinical. So I initially I understood that doing it, after that I don't know whether I will be able to give a justice to it. So that was the reason in my initial days only I decided that after I've done with my 4 years of curriculum and 1 year of internship, I will look for other options. But then after that also, during the course of time, I, with my guidance of the teachers and in the college what I was, eventually I learned it. It was not something that I was afraid, but eventually slowly or steadily, when people were carving premolar, at least I could carve a canine. So that was the stage. So eventually with the help of, I, one-on-one every year, I passed it. It was not that I was bad in academics or in practicals, but it was
Yes, you
fine.
never
So I
failed
passed.
also.
Never failed, never this thing.
So you did
So I
well. You did
got
quite
good.
well.
Yeah, yeah. So I got good marks and everything. That was fine. But eventually there was something that was no, Then eventually after I completed my 4 years, and then during internship I was like started looking for options. So the first thing, what I did was I started, a traditional thing was, let's plan for UPS.
Okay.
So okay, so what I did during my internship is I joined a UPSC coaching class. So like, so let's try this thing. So something, first let's try. Then I joined it. I did, did the entire coaching for during the internship, and then I understood, okay, so this is going to take something more time. It is not predictable. And once you're passed out, you develop a pressure from family that, okay, now you've done your graduation, now what next? So eventually now, if I'm a dental graduate, everyone may expect that I will open a clinic or start practicing. So that was the thing. Even my family started, then I got into the market, and then the harsh reality hit that, fresh graduates, what the situation is. So it, that made me double think that, okay, fine, what you had decided in your first week of, when you joined
College.
BDS, and right now I think that was a right decision. Okay, let's,
Make the
to
shift.
let make a shift and try. So during my school days itself, I was a head boy, and I had, even during internship they give us some administrative work, to maintain the registers and all that. And then I was looking like what options are there. So during my internship I started finding for options. So I came through this Master of Hospital Administration. Then I had other option which I searched on Master for Public Health or an MBA, but or MBA either in healthcare or something different. But
Yes.
now if you have spent 5 years in healthcare, I think you are more close to it. You develop a bond with that. So like, okay, let's do something in healthcare only. Let's not directly go and do something marketing or HR or something. Let's stick with healthcare itself. So that was the time, and then I started searching for it, and then I find few universities. So in that I had two options. Actually, I had three options. So I gave three exams in total. First I gave was Tata Institute of Social Science, that is TISSNET. Second was of Goa Institute of Management. So for that I had to give CMAT. And the third one was Symbiosis University of Health Sciences MBA program. So in that you have to give SNAP test. So during that time, as I had done my coaching in UPSC, so my journal, the journal awareness and everything had developed. So which was prerequisites in all three exams. So they had a good section of journal awareness in it. So then I, eventually gave because this was like on the priority, and there are hardly 45 seats in Master of Hospital Administration every year, and around 13,000 so people apply. Yeah, fine.
Why did you decide MHA rather than MPH?
Okay, so MPH, when I went to the curriculum of TISS on the website, it is mentioned like what is the curriculum and what exactly. So when I went to the curriculum of MHA, it was more, it involved everything. It involved finance, it involved strategic planning, and it involved a lot of things which it was not just single dimensional. It was a multi-dimensional course. So that is the reason when I went through it, it was like, this is something which I can connect to it. While as MPH was more of public health side, and it was more of your rural internships and of that sort, and also the opportunities which I saw in MHA, I thought I had a better opportunities in that. So that is the reason I choose MHA and not going into MPH.
This is a very good
Basically,
advice because a
yeah,
lot of
you
people
need to,
just randomly get into MPH, MHA. They do not go through the course curriculum. So, as doctor is
yeah.
telling, you should go through the course curriculum once, understand what you like better, and then get into it. It's a very good suggestion.
So that was it. Then I decided MHA, and then I started preparing for it, because it was only not about general levels, it has other part as well. So that is
Could
how
you
I
explain the process of TISSNET in detail? How to get into
yeah.
TISS?
So TISSNET first, what happens is first there are three stages of TISSNET which you have to clear. So first stage is your TISSNET. That is your you will be given an 100 minutes exam. It is a 100-minute exam. In that there are it's a multiple choice exam. So it is on PC only. So they will allot you a center, and you need to go there, and on the PC you need to it's an online exam. So it has three sections. First is English. Uh, Second is your maths and verbal your this thing.
Hmm.
It's only maths, quant, and your logical reasoning. And your third section is your general knowledge.
Is
Okay,
maths
so
easy in it? Because a
yeah,
lot of people have
comparatively,
forgotten maths.
yeah, yeah. So what you need to do, you need to plan. So my strong area was, I knew that my English is strong, and to some extent my general knowledge is strong. So I was like, I saw what is the cutoff of last 5 years, what the general trend is. So I understood that these two sections are which I need to study very hard on it. So I need no need to lose marks in it, because in TISSNET there's one advantage: there's no negative marking.
Okay.
Whereas in other exams there is negative marking. So I had decided that my general knowledge is one thing which I will be concentrating on, and English I will be concentrating on. Maths is like mostly I will not solve which involves formulas or something, basic formulas and everything, interest, simple interest, compounding interest, profit loss, ratio proportion. These are the few easy topics which at 10th level which we do. Or the logical reasoning, if there are some questions like to understand the sequence, if one is standing behind the other, and that kind of questions, like who is standing at last, that kind of question. So I had decided that my maximum scoring should be from general knowledge and English. I have to not lose any marks in that. In maths, let's see what happens.
Understood.
So that is the reason. Then that was the first stage. Then eventually I cleared that stage first, because I knew my general knowledge was strong. So when I gave the exam, I was like, okay, confident that in these two stages I can clear the cutoff.
UPSC
So
helped
and
you.
yeah, UPSL. So I was like, okay, I will clear the cutoff at least. So then on the second stage is it's a written exam. So you need to write. I think now they have changed because of COVID. The instead there's no written exam right now. So instead of that, they give you an extempore topic, and you need to talk about it for a minute or 2 minutes or 3 minutes of that. So during my time, I had a written exam where I had to write two essays in 1 hour, around 500 words each. So there will be two topics related to hospital administration related to it. So you need to write that. So I even remember what they were like. First essay which I had to write was is medical degree compulsory to become a an administrator. And the second
Okay.
thing is, our hospital is a center of women empowerment. So these were the two essays on which I had to write a written exam. And then the third stage which is there is your personal interview. So average of all these three is taken into consideration, and on that your final marks are calculated, and your the allotment of seat is done. So this is the entire process how get selected to test.
So you told me other than TISS, you also applied for the Goa Institute and for Symbiosis. So are
Right.
these three the top tier ones, or are there other universities also which students can apply to?
I think Goa Institute and Symbiosis are the available options, close by, because I was looking near to Maharashtra. So, and also I think there is one institute known as, I think, IIHMR. That is one which provides this same course. So I think I'm familiar with these four names, which are providing this MHA course.
So they are the top tier one institutes basically.
Top tier one institutes. It will be TISS, then Goa Institute of Management, IIHMR, Symbiosis.
Okay, great. Now, what do you learn in the entire course, and what are the job opportunities available once you finish this MHA?
Okay. So in the first year, what you basically study is, in TISS, what the advantage is, you have a lot of internships which you need to do, compulsory internships. So what the, theory is only for 2 months, and, you need to go for 2 to 3 months of internship in a hospital. So in the first year, what we study is basically, organizational behavior, then principles of management, basic, accounting, they teach you. They teach you what are the different, supportive services, then they teach you what are the different super specialty services, how to manage them. Then also they teach you IT, information system technology in the hospital, how does that works. Then hospital planning is something which they teach you in the first year itself. So these are the course, and then you do two internships. That is, first one you'll be doing it is in the a private government hospital. The second internship you will be doing it in a trust hospital, and the third internship you will be doing in a corporate hospital, so that you can
Also, a
get
lot of
an
exposure.
yeah, you get a lot of exposure, and you work in all three types of, because the management setup in all three types is different. So how the management works, so they give you a exposure of all three types of of hospitals. And then in second year also, the courses will be mainly HR, then your marketing, then strategic management, quality, then your uh, supply chain management. These are all the things which you study.
Understood.
So over a period of time, all the whatever is required to become an administrator is all what all
Taught completely.
they taught you at this.
Okay. Now, what is the situation of jobs opportunities available once you finish it, MHA?
So the job opportunities right now, if you see, my course is Master of Hospital Administration, but it is not only that you got only a chance in hospital. So you have a lot of opportunities. So first will be your hospital. In hospital also there are different departments which you handle. So there is an operations department which you handle. Then you have a supply chain management. Then you have HR to some extent you can handle, and also the quality. So these four departments within the hospital is the one opportunity which you get. Then apart from that, you have, second is your insurance, your health insurance. That is another opportunity which you can get. Then you can get an opportunity into the medical devices. You can get opportunity into healthcare IT. You can get opportunity into healthcare consulting. So these are the broad areas which where you can get your opportunities to work after you doing MHA.
Great. So what is the expected salary range when you start? Before you listen to the answer to that question, please do not forget to hit the like button below, because the guests here take a lot of time from their schedule to come and give us suggestions about the particular field.
So expected salary range, if you see, I will say that mostly hospitals will be on a lower side. Then you go to healthcare IT or insurance, slightly better salary. And when you go to consulting, because the consulting firms are all multinational, so they pay you more, the best. So if I go to TISS, if I have to tell you what is the average package which goes is sorry, the minimum package which goes, not the average. The minimum package which you get, if being from government college like TISS, it's around 6 lakhs to 7 lakhs per annum.
So the next question is, what does your routine day look like? The reason is I've seen a lot of people finishing all these courses and then do not like the types of job they get. So what is your regular work routine or schedule?
So regular routine for me will be, first will be, in the morning, what I do is start off, because I'm into the operations part of the hospital. So for me, it is like, to looking at the entire journey for a patient right from the admission to the discharge. So for the entire journey, the operations part of the hospital, that hospital operations run smoothly for every patient. I'm responsible for that. So but generally in my morning, my first thing starts with a meeting with the team which I have. So I have to brief the team what is the agenda for the day, what has happened yesterday, what were the we discuss what were the any concerns which the team member, what is the status currently of the hospital. So first the day starts with a meeting and a briefing. Then after that we go on rounds, visit every patient, check that everyone is doing properly, they don't have any concerns, whatever concerns they have with any concerned department, we correct that. So that is the second thing. Then what I need to do is, on the third thing, which in the day, what is, I have to see the OPD department entirely, how it is functioning, whether all the appointments are scheduled properly, or the doctors are available, or all the rooms and everything all are set up, because all the digital, like all the digital adoption of the hospital, like everything is going on, all the OPD forms and everything are filled in a proper way, all the medical legal forms which are required, that are filled properly. So to scrutinize that is my job in the OPD. Then in the IPD part, what I have to see is from the admission, whether the admission is happening in the proper department, whether the billing, the category of the room which is allotted to the patient is, the patient has been financially counseled for that. And and then if is the patient, after the admission, if when is the surgery scheduled, what is the OT has been booked or not, and but till the discharge, if the billing is done properly, if the doctor visits properly, all the documentation, everything is proper, that I have to check in the OPD. Apart from that, what I have to focus is on the business development part, where what is the currently the business of the hospital is going, where what exactly initiatives and everything, discuss with the marketing team, understand what exactly what is happening, what is the scenario, what how much budgeting, or what is the target which we have to get in for the particular month, where are we right now. So that is all what I have to look in a particular day. And another, the most important thing what I have to do is the concerns of the patients every day who come to meet me. So there's a lot of communication with the patients who are coming in, because there will be a lot of concerns with the patient, and you are the first point of contact being into operations, that you need to talk with the patient, whatever the concerns are, solve there and there itself. So a lot of time goes in that.
So
That
if
is how my
someone does MHA and gets into operations, a regular day would be starting with a team meeting, understanding the patient flow and seeing that each and everything is done perfectly, and taking feedback from patients and working on that. This is on the patient end. You also have to look into the financial aspect of the hospital as well. So that's a very strenuous job. So if someone likes that kind of jobs, then only after MHA they should get into the operations side. Correct?
Yes, because operation is something you're never off duty. You can get a call anytime at night. If anything happens, there is not some particular instrument is not available. If there is some particular instrument damage, because you are the one, because you have to coordinate with everyone. So you have to be on your duty 24/7. It's not that once you are done at 9 to 5, particularly you are done, you can switch off your mobile and stay at home. No, it's not going to be like that. You need to be on your toes, because entirely, because what is happening, your team is looking towards you, and they are contacting you because they need some solution from you, or they need something what they have done, they just need to confirm whether it's on the right track or not. So ultimately you are the one who is responsible for, that's how it is.
Understood. So what is your advice to someone who's planning to make this shift like you have done from BDS to
All
MHA?
right. So for me, my advice to anyone who are budding dentists right now, who have just passed out or anything, first confirm whether you have interest in dentistry or not. Second thing, you might have interest, but look at your family background and your financial uh, position, whether developing that interest is going to cost it or not, whether you can support that interest. That will be the second point which you need to consider. Third thing is, what are the options you want to look for. So which options which are there, which you can get inclined towards it, and you can work on it. So it is not something that it should not happen that you have done dentistry because of some pressure, that okay fine, MBBS you did not get, MBBS you did BDS. Now it should not happen that okay fine, now I don't have anything in dentistry, let's do MHA. And this should not happen that we create a workforce of MHA who are not interested in doing hospital
It should
administration,
not be
because they
what
did
after
not have.
MHA ka video
So it should
Vish.
not, you need, yeah. So you need not to repeat the mistake which you did already. So you need to think whether this is the right choice, and then work on it. Fine, okay, this is the right choice. think about it, because I feel internship is something that duration of 1 year where you can think, you got a lot of time, you got 365 days, think thoroughly, you research about it, and then when you get your degree certificate, what you want to do, you do.
That's a really amazing advice what you have told. They need to realize whether MHA is for them and then get into it. It should not be just because doctors told me or seniors told me there is scope in it, so I better do it. Do not make the mistake what you did previously. Understand whether you enjoy or you will enjoy the particular field, and only then take the leap. Thanks a lot,
Correct.
doctor, for your valuable
Thank
time
you so
to
much.
coming here and guiding the young dentists about MHA after BDS.
Thank you so much, Dr. Satish, for giving this opportunity. It was my pleasure.
Thank you. If you like this video, do not forget to go and check out our interview with Dr. Tanvi Parkar, who went into the insurance sector after doing MHA after BDS. We will be posting the link of that video in the description below.